Sugar consumption and cancer. Understanding the causes and implications. Cancer is one of the most concerning diseases of our time, and many patients diagnosed with this condition undergo significant dietary changes. One of the most common concerns is sugar consumption, which has sparked debate about its relationship with cancer growth and progression. This article explores the reasons why cancer patients may have an increased desire for sugar and the impacts of this consumption. 1. Sugar metabolism and cancer. Sugar, specifically glucose, is the primary source of energy for cells in the body, including cancer cells. Many studies indicate that cancer cells consume glucose at much higher rates than normal cells. This phenomenon is known as the Warburg effect, in which tumor cells use anaerobic glycolysis to generate energy, even in the presence of oxygen, resulting in high glucose consumption. This characteristic of cancer cells raises concerns about excessive sugar consumption, as there is a hypothesis that diets rich in refined sugars may contribute to tumor growth. However, it is important to emphasize that sugar itself does not cause cancer, but its uncontrolled consumption may be associated with risk factors that favor the development of the disease. 2 reasons why cancer patients feel more desire to consume sugar. Many patients diagnosed with cancer report an increased desire for sugar. This phenomenon may be linked to several factors. 2.1. Metabolic changes and insulin resistance. Cancer can cause significant changes in the patient's metabolism. Some types of cancer lead to insulin resistance, a condition in which the body's cells have difficulty absorbing glucose from the bloodstream. As a consequence, the body may demand more glucose, leading to an increased desire to consume foods rich in sugar. 2.2. Treatment-related stress and fatigue. Patients undergoing cancer treatments, such as chemotherapy and radiation therapy, often experience extreme fatigue. Sugar is a quick source of energy and can provide temporary relief from exhaustion, which explains the desire for sweets. In addition, the emotional stress caused by diagnosis and treatment can lead to emotional sugar consumption, seeking comfort in highly palatable foods. 2.3. Treatment. Side effects. Chemotherapy and other treatments can alter taste perception, making some foods less appetizing and increasing the preference for sweet flavors. In addition, nausea and changes in appetite can make sugary foods more tolerable compared to full meals. 2.4. Inflammation and cytokine production. Cancer can trigger chronic inflammation and the release of inflammatory cytokines, which affect metabolism and eating behavior. Some of these substances can influence appetite regulation, favoring the search for glucose-rich foods. 3. The impact of sugar consumption on the health of cancer patients. Although sugar is not the direct cause of cancer, its excessive consumption can aggravate certain conditions that favor the development and progression of the disease. 3.1. Increased inflammation. Excessive sugar consumption is linked to increased inflammation in the body, a factor that can promote tumor growth. Diets rich in refined sugars and high glycemic index carbohydrates can stimulate inflammatory processes that favor the development of cancer. 3.2. Weight gain and obesity. High sugar consumption is associated with obesity, one of the most relevant risk factors for several types of cancer. Obesity can cause insulin resistance, chronic inflammation, and hormonal changes that favor the growth of cancer cells. 3.3. Suppressing the immune system. Studies suggest that excessive sugar consumption can affect the functioning of the immune system, reducing the body's ability to fight infections and possibly hindering its response against cancer cells. Conclusão. Embora o açúcar não seja a causa direta do câncer, seu consumo descontrolado pode agravar fatores metabólicos e inflamatórios que influenciam o desenvolvimento e progressão da doença. O desejo aumentado por açúcar em pacientes com câncer pode ser explicado por mudanças no metabolismo, efeitos colaterais do tratamento e aspectos emocionais. Portanto, manter um equilíbrio no consumo de açúcar e adotar uma alimentação saudável são estratégias fundamentais para melhorar a saúde e a qualidade de vida dos pacientes. Se você ou alguém que conhece está enfrentando essa condição, é essencial buscar orientação profissional para um acompanhamento nutricional adequado